Hello and welcome to Spine Care Fitness. I'm Dave.
And I'm Laura.
And we are here to teach you how to become your own personal body mechanic so that you can fix yourself.
Okay, so now we're back. We've already talked about the necessity to have this S-curve of the spine maintained. Now, when you're in front of a computer, this happens a lot. When you're driving for long periods of time, this happens a lot. You turn your spine into a C, and all of these ligaments and muscles and soft tissues in the disc are all being compressed and stressed. So an easy trick is to use something called lumbar roll. And I want to tell you that you do not have to spend or pay for the name. An orthopedically designed lumbar roll can be from a pretty pillow, a round pillow. All it's doing is fitting into your small of your back to protect and create this curve. When you're driving, tuck this in right where it feels good, lean back and drive pain-free. When you're working on your computer, same thing. Tuck this into the back, into the small of your back, just right here, and lean back against it, and that will create this curve or maintain this curve. Once that curve is maintained, all of these tissues are at rest. They're not being stressed. Stress will give you pain. What I'm going to talk about right now is just the basic components of the anatomy of the spine. This S-curve is made up of the different sections of your spine. The top part, the neck, is also referred to as the cervical spine. The middle part, between your shoulder blades, where your ribs attach, is called the thoracic spine. And they're all numbered. C1, C2, C3, C5, C6 is the most common beat up area because that's where we rotate to drive and turn, all of that stuff. And C5, C6 is the most common beaten up joint. Then you have your thoracic spine. Then there's 12, same numbered as your ribs. You have 12 ribs. And then you have your lumbar spine. And there's 5 lumbar vertebrae that sit on top of the sacrum. So those of you that have L5-S1 issues, that means your last vertebrae and the disc that sits on top of the sacrum is degenerated. And that's one of the most common degenerative joints of the body, again, because it's where we do the most wear and tear. We rotate, we sit on it, we compress it, and we rotate on it. So it has the highest rate of wear and tear. So that's the spine. This curve right here is also known medically as lordosis. You can have too much lordosis, sway back. Most often we have decreased lordosis. We lose this curve because of gravity and sitting and sedentary problems. Pain occurs because those tissues are now being stressed. Everything's being pulled apart because they're not relaxed with their protective lordosis here. The next step will be showing you the tricks, the techniques to restore that lordosis and balance your frame so it's friction-free and out of pain.
Well, thanks so much for stopping by to spinecarefitness.com. You can check out our site at www.spinecarefitness.com. Thanks so much. Have a great day. For even more great videos and resources, subscribe to our newsletter by visiting us at www.spinecarefitness.com. And just as a thank you for signing up, you'll get access to our subscriber-only video, The Back Attack Negotiator.